The Rapid Recovery Hip Replacement Programme at the Basingstoke and North Hampshire Hospital takes a different approach to patient care. By focusing on the patient's specific needs, each individual's recovery programme is designed especially for them. This approach to hip replacement recovery means the treatment you receive will increase the speed of your recovery, getting you back to your normal everyday activities as quickly as possible.
The Rapid Recovery Programme is tailored specifically for each patient. It's not just related to the exercise programme. It covers the whole process from what is the best implant for the patient, to when they get out of bed after the operation, and to when they go home. It's about what is right for you.
Throughout the programme, you will be told all about what will happen to you during your surgery and recovery. By telling you every step of the process, we aim to eliminate the fear of the unknown and get you involved with what is happening.
Quite heavy.
Yeah, it is quite heavy.
Keeping the patient informed is one of the key points of the Rapid Recovery Programme. It is important that they understand what is going to happen to them in what, for many, is one of the biggest decisions of their lives.
Basically, what we're going to look at is why you're having your hip replacement.
A key aspect of the Rapid Recovery Programme is the hip school. In the run-up to your operation, you'll need to attend classes. The good news is that Hip School not only prepares you for your surgery, but also gives you the opportunity to ask any questions about your hip replacement and the recovery process.
Hip School is important because we know that patients having a second hip replacement always recover much faster, and we think this is because they know what to expect, how to prepare their home, and also eliminate some of the fear.
At Hip School, you'll be given a detailed exercise programme, which you'll need to start before your operation. You'll learn how to use any equipment you will need post-operation, and you'll be shown how to use crutches.
The rapid recovery approach allows patients to mobilise at their own rate. Not so long ago, patients would have been kept in bed for 1, 2 or even 3 weeks. Now, we allow them to mobilise much more quickly. Most patients will be up, walking by the first post-operative day, doing stairs by the second or third day, and are normally ready for home within 3 or 4 days.
When the time comes for you to have your operation, you'll be fully prepared to make a fast and effective recovery. In some operations, the surgeon is able to perform the surgery using a smaller incision.
Years ago, hip replacements were done through very large incisions. Nowadays, what we want to do is think about the incision for each specific patient.
Traditionally, people made a fairly large incision, certainly greater than 15 centimetres. But more recently, we've been trying to use a smaller incision of 10 centimetres or less in some people.
It's important to do an incision where we can do the operation safely. We aim to do it through a small incision, but a safe incision, and thereby reduce the damage to the tissues. This should speed up the patient's recovery time.
No matter which surgical approach is taken, you will be part of the Rapid Recovery Programme.
And push up through this leg and stand.
The Rapid Recovery Programme aims to get you back on your feet just 1 day after the operation.
Patients and their relatives are often interested to hear why we get them out of bed so soon after the operation. We believe there are lots of benefits to this. By getting up out of bed, you increase the blood supply to your legs, and that helps to reduce the risk of complications. It helps with muscle strength. And also, it's very good for the patients to develop a sense of confidence that they can get out of bed on their new hip with minimal discomfort.
However, each patient is an individual and will be treated as such. If more time and a slower pace is right for someone, then this will happen. The aim of the programme is always to get the best results for each individual patient.
The ongoing care is different because each patient is an individual and we want to get them back to their normal activities as soon as possible, so we tailor their care to themselves. Lift your bottom clear of the bed.
Over a period of 6 weeks after surgery, the Rapid Recovery team will help you to regain your mobility and strengthen the muscles around your hip. An exercise programme will be designed specifically for you. This will include exercises for you to do at home, as well as the ones you practice at the hip sessions.
There are more than 50,000 hip replacements performed every year in the United Kingdom. On average, 95% of these are 100% successful. It is our duty to discuss the potential complications with the patients so that they're aware of these risks, even though these are very rare.
These rare complications are blood clots, otherwise known as deep vein thrombosis and pulmonary embolism. These affect less than 1 in 100. Deep infection. About 1% of patients develop deep infection, and on occasion the hip replacement may need to be removed. Anaesthetic risks, such as stroke, heart attack or allergic drug reactions. Dislocation. There is a small risk of your hip dislocating at some point. Leg length. Some variations may occur after surgery. 1 to 2% of patients may need a shoe raise. Swelling. Knee and ankle swellings are common in the first 3 months after surgery. With proper exercise, this will go away. Minor aches and pains may also occur, especially scar discomfort. This usually settles. Very rarely, nerve and artery damage can occur. This may lead to weakness or loss of feeling in your thigh, foot or leg. You must remember, your new hip is a man-made piece of machinery. It may not last forever and could wear out. 95% of hips, however, will last longer than 10 years.
It's our responsibility to make patients aware of the potential complications of a hip replacement. We don't intend to frighten them. Patients need not be worried, as these complications are very rare. More than 95% of our patients have had a successful operation and are extremely pleased with the outcome.
Shoulders, very good. Excellent. Gently turn round and come back the other way.
Again.
Well, it's 6 weeks now since I had my operation. I think I'm doing good because I'm in my car, I'm doing my shopping, washing, ironing, all the usual things which I couldn't do before.
I'm just going to watch your walking.
With almost 50,000 hip replacement operations performed every year in the UK, this particular surgery is an extremely successful procedure. Being part of our rapid recovery programme means you'll be back to a more active and enjoyable lifestyle as quickly as possible.
The Rapid Recovery Programme starts when the patient comes to pre-assessment, and we follow them right the way through to the 6-week checkup and beyond. We have a multidisciplinary follow-up in this hospital, which is unique. So we can assess them at every stage and actually progress them individually rather than as a group of patients.